Over the last 19 days, to be more specific, starting May 19th, we have been working assiduously to contain the most recent wave of COVID-19 cases. Our aim in all of this is to flatten the curve through contact tracing, identification of cases, placing them in isolation, finding the contacts, placing them in quarantine, testing of all contacts and cases, targeted and random testing, vaccination, and the restrictions you just heard about. The Ministry of Health continues its robust contact tracing exercise. Again, and I want to just reiterate, the aim is to identify all cases as soon as possible, place them in isolation, and identify their contacts. And all of this is to break the chains of transmission of the SARS-CoV-2 virus. Through our contact tracing process, 6 schools were recently implicated. In other words, some students or positive cases were identified at 6 schools. The impacted students and teachers, they were tested, asked to self-quarantine, and then at the end of quarantine, they were tested. And at present, 5 of these 6 schools have been cleared. The Seventh-day Adventist Primary, the Sandy Point Primary School, Charles E. Mills Secondary School, Washington Archibald High, and Bastia High. We are presently awaiting the results from the Tyrrell Williams Primary School. Ladies and gentlemen, we have prevented an outbreak at either of these schools, and this is a positive. Again, I cannot overemphasize our contact tracing process. Since or over the past 19 days, we would have interviewed over 1,440 contacts of cases. 870 of these were or have been released from the quarantine process, and we have approximately 570 persons remaining in quarantine because or through our contact tracing process. Ladies and gentlemen, our contact tracing process is working. Through this process, we are breaking the chains of transmission. In other words, we have prevented a significant number of new cases just because of this process or public health tool. Again, this is another positive. Our national COVID-19 vaccination program continues to date, meaning as at Saturday, as at end of workday Saturday, 29,628 COVID-19 vaccine doses were administered, 22,542 doses in kits, 7,086 in Nevis. 64% of our target population covered with the first dose. 26% of the target population covered with the second dose or fully vaccinated. So in other words, we have a significant number of persons in the Federation with acquired immunity. Ladies and gentlemen, this is another positive. At present, we now have a total of 94 confirmed cases of COVID-19. You would have heard that over the past 72 hours, we've received positive results for 11 of these cases, 8 on Saturday and 3 early this morning. 53 of these cases have fully recovered. We are monitoring 41 active cases. And now this update is live. Minister of Health just told you about 2 hospitalizations. We now have an additional 2 persons hospitalized as a result of COVID. So that brings a total of 4 hospitalizations. One case, moderate to severe COVID-19, another case, moderate COVID-19, the other two, mild to moderate cases of COVID-19. What are the factors fueling this wave of cases at present? Now, based on the information gleaned through our contact tracing process, we are finding out, or we are realizing that our private and public sector entities are not in full compliance with the COVID-19 prevention and control measures. We are also realizing that a number of individuals on an individual level, they are not in strict compliance with the COVID-19 prevention and control measures. In other words, put it simply, individuals are not wearing their face mask when they should, or when they're in the public domain. They are not ensuring that their hands are properly sanitized after touching high-touch areas. In other words, some of the business sectors, employees come into work and they are experiencing respiratory symptoms, and they are working 1-2 days while experiencing respiratory symptoms. We've said before that if you are experiencing respiratory symptoms, you really need to stay at home. You really need to get medical attention. And even more importantly, you need to make sure that you wear your face mask at all times. And then, of course, we still need to reach the herd immunity threshold. So these are the main factors fueling this wave of COVID-19 cases. So what's the way forward? One, we must continue our vaccination drive. Ladies and gentlemen, this is the best tool that we have at present in terms of fighting this pandemic. If you are fully vaccinated with the AstraZeneca Oxford vaccine, you will enjoy a significant risk reduction in picking up the virus, significant risk reduction in your ability to transmit the virus, and there's a significant reduced risk in your becoming very ill or even dying from this illness. Again, the dosing interval is anywhere between 1 month to 12 weeks between the two doses. So we must continue our vaccination drive, because this is going to provide you the acquired immunity, and it's going to help us to break the chains of transmission of this virus. We must strengthen our contact tracing process. So over the weekend, we doubled the number of individuals or staff members involved with contact tracing. So for us, that's significant, and we are improving our efficiency within which we are operating in terms of getting the data and contacting individuals in an even more timely manner. 3, test. That's how we are going to pick up our cases. So we will continue testing contacts, testing the cases. We are conducting targeted testing and random testing. So our community-based team continues with its testing process, and we are also increasingly doing more testing at the hospital, that is at the JNF General Hospital. So COVID-19 tests can be had or accessed at the JNF General Hospital on the respiratory side of the emergency room. We must improve adherence to the COVID-19 prevention and control measures. And so we want the business sector, and I mean private and public sector, to come on board in terms of more strict adherence to the COVID-19 prevention and control measures. So we want entities to keep a log of the patrons and your clients that come in to do business. You must have the temperature checks at the door. We also want you to screen your employees when they come to work. You need to make sure you do not have any employees on the job who are experiencing flu-like symptoms. You need to determine the number of individuals who can be permitted in your establishment at any one time, because you need to adhere to the physical and social distancing recommendations. All patrons, all employees must wear face masks at all times. The mask must properly cover nose and mouth. And so we want the business sector to come on board and to ensure that these protocols are adhered to. And then at an individual level, we want individuals to be responsible at this point in time. In order to protect you from the virus, you must wear your face mask. You must properly cover your nose and mouth. Make sure to maintain a distance, a 6 feet distance between yourself and others while in the public domain. Sanitize your hands. Make sure you do so before and after each human interaction. Boost your own immune system and get vaccinated if you haven't yet done so. We need to maintain the restrictions that are already in vogue, and these are highlighted by the SRNOs. Our schools remain closed. We need to remember the 50% capacity on our buses and the ferry. That's very important because it's going to break the chains of transmission while you use the public transport system. There's a restriction on contact sports. We need to adhere to that. And so this week there will be 2 World Cup qualification matches. And only approved officials and players will be able to attend these 2 upcoming World Cup qualification matches. One scheduled for tomorrow, Tuesday afternoon, and the other scheduled for Saturday afternoon. This slide should be updated. There's no curfew or restriction of movement daily, starting at 8 p.m. until 5 a.m. and starting tomorrow. There's restriction on regional and international travelers who are expected to submit full proof of vaccination. Citizens and residents are exempted. Ladies and gentlemen, apart from along with vaccination, these are some of the most important actions that you can take to protect yourself from the virus. Because I don't know if I have the virus, and so if I wear my face mask, hand sanitize, maintain my distance, it's going to prevent me passing it on if I am infected. Or if I'm not infected, it's going to prevent me contracting the disease from someone who may be infected. So these measures are very, very important now that we are in the middle of an outbreak. Do not wait, vaccinate. Thank you.